Supportive and palliative care across Baylor healthcare system, really across Baylor Scott White, is a multidisciplinary program that supports patients and families facing serious illness, and that palliates, that means comforts or treats the symptoms of serious illness.
So I have stage 4 colon cancer. I've been under treatment, chemotherapy treatment, for a little over 2 years. I went to the outpatient evaluation and treatment center here at Bumsey, and one of the nurse practitioners said, let's get you a palliative care consult while you're here. And my first reaction when I heard her say that was, oh God, I'm dying, you know. I thought, it's over.
I met Amy a couple of months ago. Turns out she was a nurse who'd worked here for quite a long while, and I was afraid that she might think, oh, supportive and palliative care is coming to the room, I must be dying. And she wasn't. Absolutely not.
Luckily, Dr. Fine came by and he spent about an hour with me that evening, talking through my situation and educating me to what palliative care really was.
We treat patients with all kinds of medical problems. Anyone with a chronic life-limiting or serious illness with symptom burden or care planning needs.
Each of the team members brings something different to the table, and they get together every morning and review the patients on the list and evaluate which of the team members would best serve that patient that day and what that patient needs.
I went through the entire palliative care consult, so I saw music therapy, I saw a child life specialist, I have grandkids. I have a special needs son at home, so they helped me learn how to talk to them. I had the full service of palliative care while I was in the hospital that week, and it was life-changing for me. It really changed my life.
The music can really help not only the patient, but the entire family and the nursing staff. The patient needs to be treated as a whole person and the whole family, from the chaplains to the volunteers to child life specialists. Everybody is concerned about the whole family, not just the patient and not just their medical condition.
Spiritual support is one of the most important aspects of what we do, because people are coming up against the limits of their life. When people face their mortality or the limits, like I said, their functionality, that is something that touches on a deep spiritual place, a deep spiritual wondering. And so we try to embody some of that presence, that spiritual presence, that yes, God is journeying with you. We are journeying with you through this.
Living with a chronic disease is hard. And these people, there are a lot of different aspects that make up a person besides just a disease state or physical pain.
Baylor has Provision Child Life Services to help work with well children who have an adult in their life that's seriously ill or injured. And so we're able to support them and their families to help them as they navigate the challenges that they're facing.
Now my grandkids can come and visit me in the hospital when I am sick and not be scared of touching that big scary bed or being close to Granny because she's got these weird tubes hanging off of her shoulder. That was a huge deal to me, and I'm a nurse. So you would think I would already have those skills. I didn't have those skills because this nurse has never been a patient before.
We really are about helping people live as fully as they can live, as long as they can, and to be as comfortable as they can. It's amazing what we see when we can help families or patients to get out of pain. You know, the change that they can overcome, you know, in just a brief period of time. If they came in tremendous, intractable pain and they leave feeling like a new person, even though their diagnosis is the same and their prognosis is the same, they're much more comfortable. And so they're able to live more fully with their family and to be able to enjoy their time much better.
When you're having pain or sickness, you don't have the energy to fight the cancer. You know, that makes it harder. And I'm like, if you can take that away from me, I can fight this cancer. I can keep in the fight. And that was it for me. Now my oncologist can manage my cancer, manage my chemo, manage my treatment, and then these doctors can manage everything else for me. And it's really been a great opportunity, and I had no clue what they offered. I had no clue.
I don't know, within 48 hours she said, you know, more cancer patients need to know about what you all do. This has been fantastic. I feel so much better. I'm reassured. You're giving me guidance.
Ask questions. Ask about it. Every healthcare system has palliative care available, so even if you're not at Baylor, ask about it. They're helping me feel as normal as I can. They're taking me back to where I was before I found out I had cancer. And so that's what I would tell patients, ask questions.
If we can help patients live better and live longer, walking along simultaneously with the oncologist who's trying to make the tumor stay away as long as they can, it's a pretty wonderful thing.
We make people better to help patients have more good days than bad days and to live their life as long as they can in the best way possible, doing the things that they enjoy.
At some point, they may have to help me manage my end-of-life issues, but right now they're helping me manage my life. And that's it, that's the key.